Now, something else that a lot of people are worried about, the dentist, except for Steve Eaton. What would you choose, a dentist appointment or a massage? Pull a molar or melt under a masseuse's magic hands? Not much of a contest. But what if you combine the two? Nancy Raisinen's sphere of dentists goes way back.
There's about 5, and I had several cavities, and he didn't use the Novocaine. So the first few years of my life, dentistry is really painful.
Doesn't take it personally, but Dallas dentist Lauren Berland understands why a lot of people don't like him.
People are leaning back, they're opening their mouth, they're strained.
While he's willing to pump his patients with as much painkiller as necessary, Dr. Berland thought there might be a better way. It turned out the solution was out of his hands and in someone else's.
People have anxiety and their hands are clenching a chair.
Yeah, I was nervous when I had those.
Now, a licensed massage therapist roams from room to room, from root canal to routine cleaning, searching for stress.
I do it before, and I can do it during. I do their hands. Usually when he's doing the anesthetic in their mouth, he's doing the shots, getting them numb. I can do their hands. I've done people's feet before.
Patients approach the appointment with a certain amount of anxiety. They have to kind of surrender their mouth, and that increases the stress level, the adrenaline in the body. The more adrenaline in the body, the faster the anesthetic wears off.
Today I just had a cleaning, but even still, you don't like people probing around your mouth, so it's a little disconcerting. It's nice to have somebody taking your mind off of what's going on.
The days that when we do use massage therapy, I know the patient doesn't require as much anesthetic, meaning that they're not feeling it, they're not uncomfortable. Because that's what I use as a gauge as far as the anesthetic. If they're uncomfortable, I use more anesthetic. With massage therapy, we rarely have a problem.
Last week there was some guy who was clenching to the chair, and you try to get their hands free so they're not clenching. If you do something with the hands, and there's pressure points in the hands that can make you forget about what else is going on, but most people clench, and you can kind of help them, you grab their hand and you do something with their hands so they're not thinking about, they're feeling all this in here, and you can kind of concentrate in your hand, not your mouth.
You forget you're at the dentist, and you're not like waiting to start. That helped a lot.
So when Dr. Berland leans over and says, "This won't hurt a bit," he means what he says.